This is Steve Smith at WCG Patient Radio. WCG focuses on the ethical, safe, and efficient conduct of clinical trials. These podcasts highlight transformational opportunities of value to patients through awareness, access, and participation in clinical research. We're speaking today with Christopher Gantz, who has built special programs that help his hospital connect with minority communities to increase engagement and access to better health care by those communities. Christopher Gantz is the Senior Director of the Regional Liaison Office at the Sidney Kimmel Cancer Center at Thomas Jefferson University Hospital in Philadelphia. Since 2005, Christopher has worked on multiple clinical trials projects with recruitment goals ranging from 500 to 10,000 participants. He has gained experience in implementing all operational components of a research project and is leading the initiative to develop services that will reduce the burden of study recruitment across the Research Institute. Mr. Gantz has an MBA and Doctor of Business Administration. He has also built programs that help his hospital reach out to traditionally underserved minority communities to give them access to enrollment in clinical trials. Hello, Chris.
Hello, Steve.
Tell us about the Sidney Kimmel Cancer Center and Thomas Jefferson Hospital and its mission and how that relates to the programs you've built there.
Absolutely. So the SKCC, as we call it, the Sidney Kimmel Cancer Center, is a very robust cancer center. It's one of 30 in the country that are NCI designated. And their mission is to provide cutting-edge cancer research to the community and advance cancer care. And so the way that interacts with my mission, or the mission of my office, is that we are focused on engaging the community, which is a core component of the SKCC's mission. It's engaging and educating the public about their role in research and the way that we move research and breakthroughs forward together.
How did you come to be involved in this work?
Well, my sort of path to be involved in this research started from my earliest experiences with research and recruitment and retention of research participants. From the very first study that I worked on, I found that it was very difficult to meet the recruitment goals of the study. And then as I moved on through my career, I found that it wasn't just that early study that I worked on. It was generally sort of an issue that many researchers face in sort of making sure that their studies are successful. So I worked to develop dedicated resources that could be used to kind of alleviate that problem. So I really, focus on ways to engage the community and develop a systematic way to reduce those barriers to recruitment and retention.
So it's very true that when patients can get into a clinical trial, they often are getting access to a medication that they very desperately need, and the clinical trial is the only place they can get that medication until the drug is approved. And some of them need the trial now. So it's wonderful if they can get access to a medication that's going to help them. But a lot of people report having difficulty finding a clinical trial or connecting to it. And then we have the whole problem of a lot of underserved minority communities that are underserved in general in healthcare. This is widely talked about in medical circles these days. So tell us about something you call the dedicated recruitment core. I understand you have a unique model program for reaching underserved minority communities that involves establishing a, quote, honest broker, unquote, network. Tell us about that.
Yeah, absolutely. I appreciate the opportunity to talk about it. And you're right. I think that the problem is twofold. It's both that the community has trouble finding studies that they may be interested in or may be relevant to them, and then investigators have trouble connecting with the community and sharing information about their studies. So early on, I realized that if we centralized a service, if we had one group instead of sort of many studies trying to solve the problem independently, that we could centralize things and that we could really think through the process. And you mentioned the honest broker mechanism, and that's a key component of the dedicated recruitment model. The idea being that if you were an investigator and you want to connect with a population that you might not normally have access to, that you could work with us as the honest broker who would reach out to that community, to those members of the community on your behalf. And in that case, if the individual is interested in participating in your study, they could contact you directly, and then you could enroll them in your study. If they weren't interested, you would never know that that person was contacted. So we act as sort of a buffer in between the community and the study team. And then if the person doesn't want to receive future communications, they can also opt out through us, and then they won't receive future communications about research. And what we do with that model also is that we reframe the ask. So, oftentimes you'll see in a communication, the study team, they want to make it sound very exciting to participate in the study. And it's not always necessarily an exciting thing to participate in a study. There's a time commitment, there's the logistics of getting there, and sort of all the different things that come with participating in a study. So we take a step back and we work with the study team to develop marketing materials or recruitment materials that sort of, reframe that ask as really what it is. And it's a partnership between the members of the community and the study team. Without members of the community participating in studies, that study doesn't happen. Research doesn't move forward. So we do try to spell that out in the communications, and that's a much more powerful message. I believe that resonates a lot better. And we've had really great success with this model that we've been working on. We built it out originally. I built it at Children's Hospital of Philadelphia, and now we are taking it to the SKCC, and then other places across the country are also adopting a similar sort of framework, such as Stanford University. So it's been really great to see this model grow and this sort of different way of engaging with the community.
How do you leverage resources across the institution and then also across external communities to make this work for the advantage of patients?
Yeah, so having sort of the centralized resource allows us to be more targeted in our approach. And so oftentimes we see, that there may be groups that are working to recruit the very same population, but they don't know each other. So they're doubling their work or tripling their work as different studies are trying to recruit the same people. And that members of the community might begin bombarded by multiple messages. So we stand outside of that group. We sort of have a high-level overview of the studies that are going on and can help to coordinate that and sort of reduce a lot of that redundancy and maybe find opportunities for teams to collaborate. And then in regards to working with a community, so study teams can sometimes be really good at creating connections with community members or community organizations, but they may have to step back from the involvement they have with that community organization as the needs of the study change, or as the study ends, that relationship may fade. So you often have study teams sort of, reinventing the wheel, reinitiating contact with community groups, and then, having that fade and be reinitiated. So what we're able to do is maintain long-standing relationships with community organizations and community groups. And that way, it's not a fresh start every time a study team wants to come in. So we can say, we have a study team that's very interested in working with you or partnering with you. Doesn't mean you have to work with this group, but, would you at least hear them out? And in a lot of cases, because we've maintained a relationship with them and they know us, that they'll at least listen to what the study team has to say, and then they make decisions about whether they want to support that study or not. But it's been a really effective tool, too, for keeping people engaged and also for disseminating information about the results of study teams, which also is something that sometimes gets lost. So as members of the community and community organizations participating in a study, they're very interested in learning the results of that study. And sometimes the opportunity to communicate that information back to the community is a loop that doesn't get closed. And so we're able to make sure that happens.
I can imagine that helps you the next time around, that you've had that relationship where they actually got that results back to the community. So because communities sometimes complain about the fact they didn't get results back, and that certainly doesn't help next time you're trying to recruit.
That's absolutely right. And it really does create more of a partnership dynamic in doing that. And yeah, it is key. I think about that, in my own, like, working in research, I've often participated in a number of studies, just sort of, working down the hall from a study team that might need someone to participate in a study. And I think about the number of times that I never heard the results of a study. And it's a difficult sell to say, hey, you're very important to us. We really need your help. And then not close that loop, and it's the next time that person might be asked to participate in a study, they might pause and think, well, I'm not really finding out what's happening. It's not really, I don't know what the results are. So that is something that we definitely see as a challenge that needs to be addressed, and we're able to do that by having a dedicated model.
So in this time of COVID, we have a lot of global headlines about U.S. cities and how ethnic minorities have been especially hard hit by that disease. And that brings out the story that's well known in healthcare, that there are many underlying health conditions in higher prevalence in minority, low-income minority communities especially, not only COVID, and that these underlying health conditions add up, and it's quite a complicated health picture, and one that also includes a lack of access, a lack of being invited in for good health care, a lack of being able to access it, reach it, or find it. Is this a situation that your programs are designed to improve?
It absolutely is, and so certainly COVID-19 has highlighted these challenges, but they were certainly something that we've been working on since sort of the inception of our group. And so, engaging, it's interesting. We actually had the opportunity recently to connect with a local high school, and we do work with different high schools and their STEM programs. And that is one of the ways that we actually see an opportunity to create a paradigm shift in the way that both our organization and the community thinks about research. So in that idea or that approach that we're taking in the high school level is that we're going in and creating a sort of a pipelining program, which would create opportunities for members of underserved communities to learn about research as a potential career path. And so we plan on having students intern with us, and there's sort of there's a multiple benefit to the work that we're doing with these schools. So we think that, one, we can highlight research as a career, and certainly I didn't know that research was a career until probably after college. Maybe during college is where I first learned about. So we can allow them to learn about it earlier. We can also educate them about the importance of research and the challenges that are faced by the community. So even if they decide that research as a career isn't worthwhile for them or something they want to pursue, they know the value of research, and they will grow up to be individuals who understand the fundamental importance of participating in clinical trials. They will also communicate that message out to other members of the community and act as a resource and be able to educate people. And that really is one of the most powerful things, because, as compelling as any argument that I may be able to make, really hearing it from someone else who in the community, a friend, a family member, a loved one, that clinical trials really are valuable and important, is much more powerful, I think, than anything that we can do sort of as a sending out communication or sharing information. And so that's just sort of one example of what we're doing to sort of engage with different communities and sort of hopefully create a shift in thinking about participating in clinical trials and raising awareness as well. One of the challenges that I think across the board is that oftentimes when you engage someone about clinical trials, you have to have sort of two conversations. The first conversation is explaining what that means to be a part of a clinical trial. And then once someone understands that, that you may get responses saying, I don't want to be a guinea pig, I don't want to be experimented on. Once you explain really what clinical trials are, then you can have that second conversation about participation in the actual study. And one of the goals is to share information, educate the public so that you don't have to have that initial conversation, so that someone can make an informed decision they can decide whether they want to or don't want to, but at least they'll understand sort of why they're being asked.
That's so wonderful. Young people are such an influencer in a community, and other influencers are institutions that are not medical or clinical by nature. They may be churches, they may be barbershops, they may be grandparents. There are all kinds of different influencers, and there's a lot of awareness to build, and then you want the community, of course, to be advocating for it within the community. So young people, of course, are the people getting the fresh education and the hope for the change in the future. So sounds like a really important program you have. Tell us about the special language and culture program that was adapted for research.
Yeah, thank you, Steve, for bringing that up. That's another great success that we had that I'm really very proud of, and that was something that when I was at Children's Hospital of Philadelphia, we realized that they had created a really amazing resource, and they have a language services bank in-house, so that if a physician is treating someone who's not a native English speaker, they can set it up so that someone who speaks that language will be present for that clinical visit. But we realized that did not cover research visits. Excuse me. And that seemed like a missed opportunity, because investigators who might want to use a translator were then told that they could use an outside vendor, and that vendor would charge their grant. So that might disincentivize people to use that translator if they didn't have the funds available to do so. So myself and the woman who created the Language Services Bank, a woman named Gabrielle Janicek, and then a few other key people within the institution, we got together and worked to create a really compelling argument why that should change. And we took that to leadership at the time for the hospital and the research side. And to their credit, they were able to enhance the resources or increase the resources so that we were able to expand those language service translators to cover all research visits, which really opens things up. And that's work that we're also looking to do at Thomas Jefferson University. And I know other places are doing similar work as well. And the idea there is that our research population should match our community population, our catchment population. Excuse me. And one of the ways that we do that is making sure that people who may not be native English speakers have equal access to our trials that anyone else might have.
So how have these programs, all these programs you've described, been received? How have they worked? Tell us about that. Is there a metric for what the catchment looks like and how well a hospital is or is not reaching that type of population?
Sure. So the really great thing about the way that the catchment area is looked at is the catchment area is considered the people who live within a certain radius around the hospital that serves that community. So it's not just looking at the patient population. The SKCC, they look at the actual demographics and the population information for all the people around there. So the idea being that you want to serve the community, regardless of whether those community members are necessarily being seen within the hospital. You want to engage people. You want to make sure that you're supporting the community. And I can tell you that working at the SKCC has been an amazing experience. I know that you've spoken to other members of the SKCC, like Dr. Edith Mitchell, and seen the fantastic work that she does. And that's really been a remarkable experience to see the deep level of commitment that exists within this institution of engaging the catchment area and the community. And it's been great to build out these resources within that structure.
Yes, I know that I've heard that clinical trial participation in the underserved African American community has climbed from a much too low percent compared to the catchment area who lives around there, and to a much higher percent. And it's that what's important, I think, for the public to know is that when solutions are implemented, these things can improve. That these are not hopeless situations, and there are places like Thomas Jefferson Hospital that people can look to see what works?
Yeah, well, thank you for saying that, Steve. I think you're absolutely right, and I think I've definitely seen in the past few years an increased sort of dedication to this work across the country, and that's why I was excited about having the opportunity to talk about this today. Sort of sharing this message, sharing the information about the model that we've created. And really, making ourselves a resource for any other group that might be interested in sort of doing similar work, or even, engaging and learning about the work that they're doing. I think the more that we engage and the more that we talk about, the different approaches and sort of different best practices, that we can really create a shift in how research is done. I like to think that this is sort of the golden age of recruitment. We have so many resources and so many opportunities to engage with people that I think if we're smart about it and really thoughtful in how we do it and create sort of these long-standing relationships, it really will create a change, and it'll be a very different research landscape than it was just even a few years ago.
That is wonderful. Chris, thank you so much for your collaboration and for being willing to share that wonderful information with others. And thank you for speaking to us today.
Steve, thank you for giving me the opportunity to speak with you today. I really appreciate it.
We have been speaking today with Christopher Gantz, who is the Senior Director of the Regional Liaison Office at the Sidney Kimmel Cancer Center at Thomas Jefferson University Hospital in Philadelphia. Special thanks to our executive producer, Lauren Osmore, our technical director, David Fogel, and production team, Isabel Andresen and Roxana Guilford Blake. Goodbye, everybody.